So in March, he then
okay, bring you back to chop, change your rank for the chop.
We pulled him out of schooling work in July. We just did a lot of drawing work out the point.
Okay, back to chop, just change your rank one. More through there. Some back x-rays, both of which look pretty good. So we think it's just soft tissue. Spacing on his back's pretty good. Dorsal facets on his neck look absolutely fine. So there's no sign of any bony problem through his back or through his neck. So I think it's just muscle pain, basically. We had a feel through his neck and his back and his sacroiliac. The pain is in the sacroiliac, so we're going to stick some medication in there. And then he'll do 3 weeks on the lunge, doing some rehabilitation, doing some pole work, and try and strengthen him up behind, and hopefully make him less sore. So what we find in these horses with sacroiliac pain is that a lot of the problem seems to be involved with spasm in the muscle around the joint rather than actually in the joint itself. So our technique for treating these is to medicate into the muscle around the joint. We use a long needle and we put in a mixture of muscle relaxant and corticosteroid. The idea of that is that we try and release the spasm in the muscle around the joint, and when we've done that, we hope that by working the horse in the correct manner, we can build some more normal muscle to support the sacroiliac joint. So we typically give them 3 weeks of working without any weight on their back, lunging the horses with increasing intensity of exercise. So we put them first of all just on the lunge or the long reins, then we put them over poles on the ground, then we put them over raised poles. And we find that we get fairly good success with that. It's a treatment technique we've been using for several years now. And the response rate to it seems to be pretty good. Yeah, just going. Oh,
I can't. That's not working at the minute.
Wait. Okay.
Yeah.
Okay. Okay. Good. Okay.
So, a couple of weeks ago you saw Rio working with Charlotte in the school. It was quite obvious there was a difference between his quality of work on the lunge and the long rein compared to whenever he was being ridden. When he was being ridden he was really uncomfortable, pretty nappy and showing quite considerable signs of pain. Gordon obviously visited this week, and as you found out, he's suffering from back pain, which is what we suspected. Back pain probably is the biggest challenge we face in retraining. Certainly, it doesn't really correlate to how many races the horse has had. For example, Rio's only had 6, and quite often you hear people say, oh, he can't have a bad back, he only raced once or twice. But really, from our experience, there's no connection between the amount of races and the changes to a horse's back. The horses, the Thoroughbreds, do generally have a lot of changes to their back. In fact, the horses that we see through here, you're talking between 90 and 95% of them do have some form of changes to their spine. How significant that is to their future use is completely dependent on the horse and how the horse copes and what you're expecting the horse to do in the future. Certainly there's a few, the main areas when we talk about back pain and challenges, you've obviously, we can split it down to the neck, then you have the thoracic and lumbar region where the sort of saddle goes in the rider, and then the sacral and the ilium, and where the sacroiliac joint is just here, and that's where obviously Rio had the back pain. That presents in different ways. Certainly when it's the thoracic region or the main back, you do see that the horses, when you're putting the saddle on or you're grooming them and you're touching their back, they might be quite tender, and they're generally very uncomfortable being ridden, and not very happy. Rio's, the sacroiliac pain is slightly different. It can present that the horse actually can trot very nicely, but whenever it goes to canter or change paces at all, he finds it quite difficult, and quite often you see a bunny hop canter or a nappiness and ears back and all those painful signs that the horse is trying to tell you that they're sore. The neck is quite challenging because it can present in lots of different ways, and it's very inconsistent and quite difficult to read whenever there's an issue with the neck. But because we have so many horses that do come through here with changes to the back, the first thing we do when we assess a horse is we take a radiograph of the spine, and that's really useful to have a clinical picture, especially at the start of retraining, so we know if we are in retraining and the horse starts to show signs of discomfort, we can see if that relates to the images that we have. So the radiographs from our point of view are extremely important. So Rio, he's now heading off to do 3 weeks of rehab. Hopefully I'll pop a video back on in a couple of weeks and show you how he's getting on. And then maybe next month we'll have a look at a horse that has changes to this area of its back, which is quite commonly known as kissing spines. So that's the thoracic and lumbar region. So we'll hopefully get one of our horses out that has some changes in that area and let you know what we're doing about it.